What I really want to emphasize right at the beginning of this talk is that this has been a team effort, getting to this point to be able to present to you about the co-production of the social media, smartphone use and self-harm in young people study. Some of you here today are actually on our steering group, and we really would like to, involve you as much as possible in the discussion afterwards. And if you are not, we'd love to hear your ideas about how we go forward, because we're now at the analysis stage of this exciting study. It's been a long time in the making, and that's really what I want to focus on today, the team effort that's been involved in getting us here, because to be honest, it wouldn't have been possible without the young people that actually made the study, and so co-production has been absolutely critical, and that's what I want to emphasize. So here we go. I'm going to give a bit of an overview. First of all, just starting with a bit of background, aims and objectives. Then I'm going to hand over to Hannah to give quite a bit about co-production with young minds and what that actually involved. Then I'm going to talk a bit about the methods, how we've recruited, what the challenges have been along the way, and then the next steps in this research, which are very exciting and useful to hear your thoughts on too. Okay. So just as a bit of a background for those who are less familiar with the self-harm literature, it is obviously a serious public health concern. I think people generally do know that. But whether you know that 15% of young people are at the present time considered in community studies to actually self-harm. There's really high rates of repetition and sadly, forthcoming suicide in people that do self-harm. And typically, this meta-analysis by Gillies showed that the onset is around 13 years of age, which is quite critical for our work, particularly as obviously that's the age at which it becomes legal to have a social media account. And we actually were asked by the MRC to do this study starting with the age group at 13 years and take it all the way to 25 years of age, which was a really interesting ask on their part when we applied for funding. Can everyone hear me, by the way? Someone at the back, can you wave your hand? Yay, I got a good thumbs up. That's good to hear. So stigma impacts on disclosure a lot, and therefore on help seeking. And that's why we have this iceberg model expertly put together by Keith Horton, Kate Saunders and Rory O'Connor back in 2012, actually. When I looked at that, I thought, oh my goodness, I'm getting really old here, because this is a fantastic model. It shows that, suicide is really just the tip of the iceberg, along with the self-harm that actually presents to clinical services. Most self-harm is disguised. It's not coming to the attention of clinical services whatsoever. It's under the seawater there, it's undetected, and which is really relevant to what we've done, because we have actually tried and done our best efforts to try and capture not only self-harm that's presented to health services, but also self-harm that people just record off their own back on the app that we developed. Self-poisoning is most common in clinical populations, but as you probably could guess, cutting is much more common when you look at sort of school populations or community populations. And if any of this is triggering, I am available to discuss any points, and Hannah is as well, because obviously you've all had various experiences outside of your own research or your own sphere of life, which may mean that this topic is of particular interest. Don't hesitate to come up to me during the coffee break and we can talk some more. So what are the reasons for self-harm? They're really complex. And I think if you take anything away about self-harm, it is to know that it's a really multifaceted issue. It could be that it's the actual bullying that's happening for a young person, or the sense of isolation that they're feeling that triggers them towards self-harming behavior. It can actually be, there can be a sort of an effect that's occurring in a school. It can be due to factors from very long ago, so really early childhood experiences, child abuse, and victims can be very seriously affected in this way. And it can be not just an attempt to end one's life, but actually much more often an expression of distress or a need to release tension, release emotional tension. There's been a lot of research, and it's increasing into the role of what social media and technology might have in this, and I emphasize the word might because we don't know its true role. But this was a fantastic systematic review done by Amanda Marchant working with Anne John back in 2018. It's really, I would highly recommend it. To really, it pulls together a lot of the research groups that are dealing in this area. The Ofcom report from 2021 told us that almost 90% of 12 to 15-year-olds actually use social media, and 95% of 13-year-olds own a smartphone. If you look at American data and more recent reports, it's even higher than this, as I'm sure you can imagine. So what is the impact of social media and smartphones? We know from work to date that, okay, there's a suggestion that excessive use may well be a negative factor. But what is it about the excessive use? That's what intrigues me. I don't think it's enough to say that it's a certain amount of hours and it suddenly becomes a threshold for being bad or negative. I think that it's much more nuanced than that. Nocturnal use, but what effect does that actually have? We haven't really, as Anne rightly said in her introduction, we haven't really been able to real-time study that. Viewing harmful content, naturally enough, that is a concern, and sadly in the cases of where young people have ended their life by suicide, when you look at what they were looking at in the days and hours leading up to that tragic event, when it's looked at the coroner's inquest or indeed in public inquiry, often there has been harmful content and very disturbing images. Social comparison in the eating disorders literature is quite prominent, and obviously there is an overlap with eating disorders and self-harm behaviour as well. There can be personal disclosures, and that can often mean that people get quite a lot of detail about what others are doing in terms of their self-harm, and this can influence them in a negative way. We know that cyberbullying is also relevant. And actually, I think some of the early look at the data suggests that traditional bullying as well may well be associated with self-harm and also social media use. Social exclusion. If you're sort of feeling very isolated from your peer group, made to feel very lonely, unwanted, and there's a lot of this phenomenon. Having a child myself of 12, I know there's a lot of, oh, we're going to take this person off our WhatsApp group, and this is really very, very triggering. It's become very commonplace. School is not left at school nowadays. It comes into the home, unfortunately. I have to say that as a parent, and it can really lead to problems in these youngsters who are very impressionable. They're still learning to manage relationships, and the online nature of that relationship that continues beyond the school day is of concern. And that, for me, as both a parent and a researcher, is particularly interesting. However, it's not all doom and gloom. Online connectedness has been a real boon, and particularly during the pandemic, I think that has helped many individuals. We know that people were able to form their own support networks. Many young people found it particularly beneficial during that time and beyond. Some of those groups have actually continued beyond that, and particularly for marginalized groups where perhaps you're feeling quite as though you might be the only person in your class who perhaps is LGBTQIA+, or faces a stigmatizing issue such as the ethnic background that someone's from, and the intersectionality of some of these stigmatizing issues means that people can more readily connect with someone else or a few other people who are part of their, I don't like to use the word, but tribe. You know, if you find some other people that are meaningfully connected to you because of the shared traits that you have, that's a real plus. And we certainly didn't have anything like that before. I think that's a real benefit. I know from, you know, it can be any particular dimension of one's life, whether it be being a mother of a disabled child or whatever it happens to be, that's really useful. Educational purposes and raising awareness. We know fantastic charities like Young Minds, the foremost charity for young people. They do a fabulous social media campaign. And also there are now moves towards therapeutic interventions, as my colleague Maria has already mentioned too. So what are the gaps in our knowledge? Why did we have to come up with a new study in the first place? Well, what we realized when we looked at the literature was that it's mainly that studies to date have been cross-sectional, and they've also often just been able to look at self-report data, which is obviously biased because it depends on you remembering what your usage was. And clearly, you know, your recollection may not be accurate, and it may be influenced by circumstances following. Oh, what happened there? Oh, my screen's flashing on and off, but it's there, so that's good. It did that for you too. Okay, I'm not alone. So we need to, I think, what we really talked about with Young Minds right from the outset in our more than 5-year relationship now, isn't it? Is that we needed to be able to study change over time with young people involved right from the pre-application of funding stage right through, and look at their real world data. Okay, so these are the overall aims and objectives before I hand over to Hannah, who's going to talk about the co-production in more detail. We wanted overall to investigate the mechanisms by which social media and smartphone use underpin self-harm in young people. And the way we intended to do that was in 3 ways. First of all, look at the patterns of social media and smartphone use in the 7 days before an episode of self-harm. We wanted to determine whether patterns differed from young people who had not self-harmed. And if we found associations, we wanted to look at the mediating roles of sleep disturbance, depression, anxiety, loneliness, and both traditional and cyberbullying. I've gone off again. Okay, so I'm just going to give you a bit of an overview now. Right at the outset, I talked with a lot of young people who were South London and Maudsley service users. So there were patients of our trust in the correct age group that we were thinking of applying for funding in, and really got them on board with devising how the study should be set up. We were also very fortunate to have Stella Grantham Foster, who used to be an activist with Young Minds. She's now much older. She's doing phenomenally well. She's a paramedic in training now, but she was a co-I on the study, so a real service user with lived experience, helped us an enormous amount. She would have been here today, but she's actually on a training course. And then, of course, we had the Young Minds youth advisors and the activists, and Hannah will go into that more, as well as our participants who have helped us along the way in terms of process evaluating our study, which is ongoing. We did a lot of pre-application consultation. We had a focus group. We've gone on to have a steering group as well with young people on it. And at our REC meeting, before the study could actually commence, the Research Ethics Committee, Stella actually attended and spoke about, which I think was really helpful actually, that she was able to bring to life the study and how it would appeal to others by talking about how her siblings, for example, would feel about taking part and how she would have felt at a slightly younger age. We've also conducted workshops, and we intend to do a further one once the study its publications are actually out and are being disseminated. And what has it helped with? Well, it's actually been right from the outset, it's really informed, as you can tell, our research questions, our methods. It's helped us consider all the ethical issues in doing this kind of research. The young people have reviewed all our materials. They've been not just reviewing them, have actually helped with developing them, and have also helped with app and website testing. And as I say, from now onwards, we're hoping that they're going to be equally involved in the dissemination of our work. So I will hand over to Hannah now to tell you a little bit more about the project timeline.
Amazing. So a lot of colour on this slide. So if anyone can't see anything, we can also chat about it afterwards. So Rena mentioned that I work for Young Minds. So I'm not going to pick on anyone or choose anyone. Can you just put your hand up if you know who Young Minds is? Okay, like nice split. So basically, we're a mental health charity. We work with young people 0 to 25. That's who we consider a young person. You're going to see words on here like youth advisors and activists, and I'll explain exactly who they are, what their role is as part of our internal work with Young Minds and on projects and research like we are with King's at the moment. So you can see I actually started working for Young Minds last year, so this I cannot take all the claim and the work with. So we've had a couple of different trainer consultants on board with us, as well as different groups of young people. So we started off in 2018. You can see that as Rena mentioned, we were starting work with King's, thinking about the funding application, what that looked like, and really kind of coming together, thinking about the offer that we had, how we work with young people, and kind of what the vision was for the research. We were able to develop the project, and then obviously a big pandemic hit in 2020. I don't know if any of you remember that, but like obviously that affected the work and how we really had to adapt and change in order to work with young people effectively, keep the research going, and really just adapt and be really flexible to support young people moving forward. So Rena mentioned about like our young youth advisors. So youth advisors are young people who work specifically on projects. They're trained to talk both from their own lived experience, representing views of young people that they are connected to personally and professionally, and they will work sort of throughout projects to design, co-facilitate or facilitate, and deliver in any other ways that kind of they would like to. And I'll explain a bit more about our participation sort of process in Young Minds and what that looks like later. So youth advisors have been involved in facilitating a workshop that was developed to our delivered to our activists. So I've noticed there that was focused on the participation information sheet, consent form, and app development. I'm going to show you some of their insights later, but basically it's just them giving their views on it, and our youth advisors were able to develop that and then deliver to our youth activists. So it was a whole young person collaborative approach. So our activists are young people aged between 14 and 24 who have lived experience of mental health. That can be in a real vast sort of like different ways, basically, in terms of mental health. That could be working with services, that can be from their own lived experience of having a mental health condition or experiencing difficulties in their formative years or currently. So, you know, it gave a real understanding of what young people think when they're looking at different sort of aspects of the research, what they would change, what they would recommend. And we've got a little slide later to basically saying like what young people said and how King's responded to enable better participation with young people throughout the study. And we've got a couple of aspects there around the steering group attendance. So as well as sort of young people being able to join that space, it was also about you know, young people being able to see the minutes, being able to see the agenda, being able to actually provide comment and sort of their thoughts on that outside of that space if they weren't able to attend. And where we are now is obviously we're coming towards this later stages of 2023. So we've worked with our new youth advisor cohort to develop some more ideas, focusing on participation in the project, dissemination of the research. And we've got some steps to come, which is we're thinking about developing a survey with our youth advisors, writing a blog about sort of their experiences of social media usage and their mental health and well-being, as well as some of the research as it the results as they come out from King's. So it's really kind of involving young people at each stage in a way that they really want to and that they feel is authentic to themselves. So any questions about that afterwards, please do fire away. So these are some of the insights. I don't expect you to read them. It's not necessarily for that. It's more for demonstrating the point of how one way that we engage with young people. So we've got here, which is our first workshop, which was delivered by our youth advisors to our young activists. This was about understanding the participant information sheet, sign-up process, and the app. We've got a variety of ways that we're able to kind of gather their insights. This is a platform called Mural. If anyone is looking for a new platform to engage with young people, I really recommend it. It's just basically a whiteboard space. And what we did, I'm going to move over here now, is this is the one that I facilitated in earlier this year in June. So this is actually, we've got young people's insights here around different workshops ideas, what they would want from a workshop and sort of what they want to do. And also we had the ability then, like Rena and Amanda are able to then actually respond. So I held that session with the young people. That was their space, no one else was in it. And then actually afterwards, you can get the ability to actually interact. So young people often feel like they can feel disconnected sometimes when they're working on projects. You know, they give all these amazing insights. I don't know what's happened to it, where it's gone, what's happened next. But actually, what we've been able to do with KCL is actually involve everyone in that process. Young people know exactly what the responses are. They know exactly what's going to happen next following sort of them providing insights. So this bit here is just basically to show you that this is one way that we gather insights. And it's not only during a one-off session, it's also about, you know, them being able to revisit that at a later stage, review it with us, and just basically give us ways to learn really from what they want to do. So there was just a few aspects. This is from this year, this is from a couple of years ago. And then the next slide, really, would you mind just, thank you, because I'm going to stand here now because you can all hear me, can't you? Yes, lovely. So we've basically got a response. So there's no point in young people providing their insights if we're not doing anything with them. So we've got here some of KCL's responses, which there's several different sections. So in response to sort of the written information that was in the information sheet consent form, young people were basically just saying, you know, like, use simpler language, use language that we would use in our everyday. We don't want it to feel sort of, you know, like we're talking to a load of professionals. If we can reduce that power dynamic, then that's brilliant. So King's did that, you know, and working more about, like, you know, how the plan was to collect the social media and smartphone data. Like, how do young people want to kind of be told about it, informed about it, and also involved in that section there. I won't read all of them, but can you read that at the back? Okay, yeah, brilliant. Thanks, Rena.
No problem.
Thank you so much.
No problem.
And then the website and the app. So, you know, young people were saying, you know, you've got some great ideas about ongoing signposting and different websites we can interact with, but who else is there? And they gave basically some other examples that included like the Mix and Stone Wall. So they were put straight on to support young people moving forward. And also just around the questionnaires. So, you know, different ways of interacting and asking about like the demographics, including like gender, thinking about like actually how young people want to kind of be prepared for talking about self-harm, and actually what those questions could and should look like, really. And then, yeah, enabling young people to skip questions is always a really important thing, especially in terms of that ongoing sort of mental health need, especially around self-harm. And also about the sharing social media data. And I think what this research has done incredibly well is really being able to work with young people afterwards as well, and being able to say, you know, like, if there is dropout, like, how can we support you moving forward? What happened? To really gain an insight of how to improve this type of work moving forward. So that was just some extra bits. So lots of different ways that KCL responded. This is just more for like your information. So this is something that we've been working on more recently in Young Minds, and this is our participation framework. So when I say participation, I basically just mean young people being involved in research project work. So the way that we now talk about it, and if you're ever thinking about doing participation or you do it already, there's no right or wrong way. And I think, you know, we're talking about co-production today, but all participation is good. And I think there, you know, it needs to be sort of that recognition that actually it's okay if you don't hit co-production, that's fine. If you're doing something really authentically well to a young person, that is good enough a lot of the time. So we just think about basically how much power a young person has to make decisions, to inform the future of the study, for example. And just like in that space with that young person, how much power do they actually have? Are you asking them questions for them to answer, or are you asking sort of what they want? And there are lots of differences between the ways in which we ask questions, of course. So, and the way up here is just the sphere of influence. So like how high up are they able to influence? Is it their own sort of experience in the mental health care? Is it actually around something like research, a project? Is it around the local like ICB, like NHS sort of space and board meeting to be able to make change there? But yeah, any questions around that? It's a newly developed sort of thing that we're now working on for participation. And if anyone's got any questions about participation, like working with us around this, please let me know, because we're really keen to just like spread the word.
There's a few animated bits.
There are, lovely. So there's a couple of examples, because, you know, collaborate, contribute is all a bit fluffy, isn't it? So let's think about like, so collaborate, young person and practitioner developing an agreement and a transition plan together, and actually more about a lead of their individualized care. Might be young people have their own personal budget, can determine the best care for them. Thanks, Rena. And then if you're thinking about more operational, it's service users giving views on changes needed, management then making that decision of what to do based on the insights. And then we're thinking about if you've got more power for young people, it could be something like a peer support project. So something that actually it's a young person led space there. A couple of extra things. So when we're thinking more strategic, young people being able to receive clear and accessible information about organisations and policies. So that's right at that informed place. That's what their information they're receiving from us. But actually that's more of that strategic level of actually like, what are the policies saying? What do young people like read and understand about them? And then, yeah, we can then start thinking about actually where are young people being able to join. So young people being able to be on steering groups, board meetings, being able to meet a senior leadership team rather than, you know, their clinician. It's all really important. And that's kind of more towards that collaborate and strategic. And then when you come up to systemic at the top, young people being able to give their feedback to help shape commissioning of regional services. So like a real broad spectrum of work and participation with young people. And if you're here and you're doing this really well, that's fantastic. It doesn't matter necessarily about always leading to here, because this is really difficult to achieve. Serena. Oh yeah, we can skip that one. Thank you. Lovely. Right. So I'm gonna I've just had a breakdown of sort of the ways in which we fell into that framework throughout the research so far in the project. So when we're thinking about Inform, it's actually about youth advisors being updated on the structure, what they can participate in, updating on the changes made, agenda minutes shared from the steering group. Then we think about actually what's contributing. So young people being able to share insights, what they think about things, what they don't like, what they change. And then generating actual ideas and saying, here you go, Rena, here's some ideas for you. What do you think of it? So that's that contribute stage. And when we think about collaboration, that's that actual co-development of workshops with youth advisors, co-facilitation. So having that support from us, but actually they can design that in any way they want to, and about reviewing and recommendations for sort of the changes that have been made. So actually being able to say these are my thoughts, but actually this is what you need to change, and that being sort of done in a collaborative way.
Thank you so much, Hannah. That was wonderful. And Hannah has introduced someone there. She mentioned Amanda as being a very helpful person, and I will give her full credit at the end, but I need to mention her now. Amanda Bai cannot be here today, but she has been the project manager on 3S-YP right from the outset. She has been a phenomenal stalwart figure of 3S-YP. I work a lot in academic career development, and I could see that she had enormous potential. She's now I'm very pleased to say, she works for the Pears Maudsley as a postdoctoral research fellow. So it's been a promotion for her, but she still carries on working with me one day a week. Unfortunately, it's not today, so she can't be here. But she, I would say, as Maria well knows and others in the room well knows, has been a real driving force here. And in fact, some of the slides I would credit to her as well. So what were the methods? Well, as we say, this is the clinical population. What we mean by that is that they all had to have either been seen by SLAM or have been open to an open referral to SLAM, which is the Maudsley Hospital and its various services, in the past 12 months. And as we've said, it's a 13 to 25-year-old group, so quite a wide age range. And I'm really glad that it was that wide age range, because I don't think that, we used to say, oh, at 18, people become adults. There isn't some neurodevelopmental change that occurs at 18 or 17, 18. It's a really artificial distinction. We know that CAM services transitioning to community mental health teams can be very, very difficult. And I'm really interested in that cusp area where people are making that transition. Clinically, as Anne mentioned, I do a lot of liaison work, and one of the most fascinating roles I've held has been with university students at the University of the Arts. And so I've really dealt with that 17 plus group going into their, degrees, and more mature students. And some of them, it doesn't matter on age, they're all at very different stages of their development, their ability to handle social media and smartphones. We used what's been a very, very helpful facility called Consent for Contact, which I'll just mention very briefly. So essentially anyone that is part of our services at Southampton and Maudsley should be offered the opportunity to participate at some point in a research study. It doesn't mean that they're consenting at that point to a particular research study. It just means that we can contact them at some point in the future. And so it meant that we already knew that the people that we approached had agreed to be, well, at least they were interested in research at some stage. This did not sign them up for anything. They may not have been interested in our particular area of work, for example, but it meant that when we approached them, they were not finding out about research as a new thing. It's interesting, actually, because some of them, especially the younger ones, will have been, it would have been their parents that actually said to us that, I consent for us to be, for me as the parent to be contacted about my child. But by the time we've gone in and approached, it's actually the child has become a young adult. And so we have to obviously go through a process again of making sure they give informed consent for our study. So this was the protocol paper that we published in the BMJ Open. And what did we study? We studied mental health, not just self-harm behavior, but other aspects of mental health too, social media, smartphone usage, and we have an ongoing process evaluation as well as the data analyses that we're doing. I won't go through these point by point, but you can see here that we've we've looked at self-harm events. We used a very interesting scale to look at problematic smartphone use, which Ben Carter, one of our co-investigators, has used in other work that he has done. It's called the 3S-SV, and it's a really nice way of capturing usage and whether people, feel as though they're missing out. And it asks some really insightful questions, and I think it's going to be really interesting to analyse in one of our future outputs in the very short term. Actually, we're going to have that ready. Smoking, alcohol, drug use, obviously sleep, depression, anxiety. We had use of the Hughes scale, which is a nice 3-item scale for loneliness. And we also use the revised Olweus scale for bullying. Have I got to wind up a little bit? 1 more minute. Oh, my goodness. So I won't go through all the different aspects of social media use, but there you go. We also looked at the intensity of usage by time of day and app usage. This is the elements that we need to look at in our process evaluation going forward, not just looking at how we recruited, but participant involvement, researcher reflections, and the co-production process. You can get more details on the flowchart of the patients through the study by looking at our protocol paper. And I'm not really going to say too much, except to say that we are really pleased that the 362 individuals that we have in our cohort reflected the base population that we recruited from. The only slight difference that I will just highlight your attention to is that we over-recruited for female. So 70% were actually female, whereas in the base population of those we sampled from, there was 61% female. That's the only real difference. You'll have to take my word for that. I'm pressing and nothing's happening. There we go. And in terms of diagnosis, again, we also tended to be recruiting those with affective disorders and anxiety disorders, but really it was open to anybody with any primary diagnosis. We were, and I would attribute this not just to Amanda, but the rest of my research team, Grace Williamson and others along the way, including 2 study nurses who worked with us, Alba and Jack. We only had 17 withdrawals in the whole 6 months of the study. So I'm really proud of that. 4 gave no reason, and the others, they're very, very minor, they're small numbers. We have looked at each in detail, and we have tried actually to get back in touch, and we're having some success in that in our process evaluation, because I think it's important to find out for those individuals what actually has gone wrong. I won't go through all these challenges and solutions because I'm out of time, but essentially what the big one I want to draw your attention to is at the point of applying for funds, we thought we would be able to extract data more easily from smartphones. Actually, our sample, more than 70% of them were using iOS. So because of changes in the way Apple works, we were unable to actually passively extract that data. And with regards to social media, there at the point of when we were applying for funding, we were going to be able to use an API or application to be able to get direct delivery of the social media context. Instead, we've had to get people to upload their data manually, which is not ideal. And we've written about that in a commentary piece fairly recently. So yes, we're really looking forward to our continued relationship with Young Minds. We've got the data analysis underway. I'll leave everything else till questions and coffee time. Thank you so much for your time and for listening. And of course, here's Amanda, and here are all my colleagues. But most important of all, thank you to all the young people and to Young Minds.
Thank you so much, both. That was amazing. And having been involved in a project like this, I think you just can't understate how much work it is to get these studies done. So it's really impressive work. Are there any questions? Louise?
It's a tiny detail, but I was very interested and impressed by the withdrawals. You mentioned that only 17 kind of decided to withdraw throughout the process.
Yes, absolutely. And I was actually discussing these with Hannah just last week. The PI, it was interesting because she was saying, oh, what happened with the PI decision? That was a very interesting one. So
That's my question.
Yeah, was it? It was her question too, funnily enough, Hannah, wasn't it? So what happened is So we started off January 2020, complete rewrite of what we had planned for the study protocol, because obviously pandemic coming along. By March 2020, it was very, very obvious we weren't going to be able to meet all these individuals in person. That was going to be our recruitment method. So we had to move to online with lots of text, emails, phone calls, and the option of video calls if people preferred that. We also offered face-to-face, but in the end, no one actually wanted face-to-face. They were quite happy to be recruited in this more distant manner. The person who I had to take a PI decision on was, we actually found out that the initial call had been taken by a friend who had much better English speaking than the person that should have been in the study. And it was just a misunderstanding. So I had to take the decision that was not valid. They didn't have sufficient English capability to actually to participate. But the others were, yeah, time commitment. It is a time commitment to have basically questionnaires coming through on a monthly basis, to have to complete those. We had 3 people saying that they couldn't do that. 3 people also saying that they just really weren't interested a bit further down the line. But I think that's pretty low number. Poor current mental health. So a couple of individuals did go into hospital. That didn't mean that they couldn't carry on taking part. There were more than just 2 actually. But you know, if someone was really unwell, perhaps under section in hospital, we were maybe informed by their parents or someone close to them that it was not going to be appropriate to continue contacting them. And sometimes the young person in that situation would also find it inappropriate. So we obviously took them as a withdrawal. Some people did find, even though they'd done the baseline questionnaire, they found the sensitive nature of further questioning. 2 of them found that undesirable. And data privacy only came up, believe it or not, for 1 person after they'd actually taken part. I think Maria mentioned it's about 1/3 of individuals for whom we have social media, smartphone, and electronic health record. Electronic health record consent is for more than 95% of individuals. But the reason social media and smartphone data is on far fewer is those 2 reasons I mentioned there, that more than 70% are Apple users. Very, very difficult to, in fact, impossible to passively extract that data using an app. And social media, because it's a burdensome process. You have to go into each social media platform and as an individual request your data to be emailed to you and then upload it to the platform. That's quite active, and it took, I have to say, my team worked, you know, all the hours, the evenings, the weekends to actually get that data, which is extremely rich, but it is on only 1/3 of our sample. Thank you.
Thanks so much, Rena. I guess the things that are really, you know, a real change for these sorts of studies is participant burden, isn't it? So there's much in the studies that I'm involved with doing this sort of work. We talk more about participant burden because you're asking people to fill things in very regularly, much more in real time. So very impressed that you had such a low dropout rate. And
I can only credit my team for that. They were brilliant. I mean, I was just there as a figurehead, but you know, they were the ones doing all that contacting, getting to, you know, you do end up having a rapport with people, finding out the times when it's good to call back, actually registering those and diarying those times and calling back when they were asked to, leaving times open, being really flexible on the participants' needs.
And I guess the other interesting thing about this sort of work is that we did a systematic review about images of self-harm and its impact on young people. And when we did that review, loads of the social media data was being analysed without consent.
Yes.
About half. And one of the big things we said in the review is this needs to change. You know, this is just because young people place it publicly doesn't mean that we can just go and take it. And so I think as well that, you know, the way you're consenting, the way you're involving people, this is the way forward for this sort of research. So I'd really like to thank you both. That was fascinating.
Thank you.
Yes, let's clap.
Thank you so much.